I love the new Siri voice on those Zoom meetings. Mark, how the heck's the weather been, man?
Super hot. I don't know how hot it is out by you, but even right now it's like 90 degrees here.
Yeah, we've been, I don't know. This is the time when you don't want to live in Southern California or Arizona, or, pick your place that people move to die, when they want to warm up. Now we had a week straight that was triple digits, and it was brutal. And that particular week, our AC went out in the office, which was unusually spectacular. Yeah, it was great. But on the same day, I had a call with a dentist who's a friend of mine in Seattle, and she actually told me to be quiet and stop complaining because Seattle was 106 when Southern California was 100 degrees.
Totally.
Yeah.
I can.
You guys can relate, though.
I can relate. And then we just missed by maybe a half a mile the tornadoes that were out here. So it puts a different perspective on life really quick when you see your neighborhood kind of blown over.
Yeah, that's rough. So I seriously, man, I have bookcase envy. I'm telling you, like my bookshelf back here is paling in comparison to the built-in.
You're all right.
So I got to ask, I know this is not part of our slides tonight, but we are a couple minutes early. So I want to ask you off the cuff,
Sure,
with no context, what is the best excuse you've heard from a patient that doesn't want to admit that they snore and or have sleep apnea?
You know what? I think the ones that surprise me the most is the men, and I was going to touch on that a little bit. Is the men they don't care. They have no thought process of why. They just think they sleep well. So it's like, hey, it's not my problem, it's her problem, or my bed partner's problem, or I don't have, I'm all by myself. It doesn't matter if I snore, I get a great night's sleep. I get up 10 times, but I get a great night's sleep. They just don't know it, and I don't know if that's a stumbling block for me, but it's like, well, when you do find out, it'll be too late because everybody else will know but you.
Right.
That's the truth, right? I mean, it happens. And then I think on the other end, the women that we hear get crazy anxious about it. They're either embarrassed or they got to go talk to their MD, 3 times before they do something. Yeah, which is fine. At least we're heading in the right direction.
Yeah, it is. It is always fascinating to me, though, that when you start talking to people about how they sleep or sleep in general, everybody has a story. I sleep great. Watch. They fall asleep in 20 seconds. In your dental chair while you're trying to work on them, or somebody snores like a freight train. I mean, you ask Chad. Chad was some young kid, fell asleep behind the wheel and drove home and just parked in his front yard and had no idea.
Wow.
I mean, it's funny and not funny at the same time, I guess I should say. Yeah.
I see a little bit of that glare back again. Sorry.
No worries. It's just the aura of glory behind you, Doc.
A little better.
Yeah.
Like those shorts.
Yeah, that's the Zoom suit.
That's for real. There you go.
Yeah, we're good, man.
That's a little better.
Yep. Well, it is 5 o'clock Pacific. I can't do all of the math, but 7 o'clock Central and 8 o'clock Eastern. So for everyone, it looks like we got quite a crew tonight joining us. Want to thank everyone for joining. Before we get going, I always do this. We want to open it up. Tell us where you're from. Love some of the interesting ones, like, yep, howdy from Nashville. What's up, George? You're the first one. You're always the first one. You have it like typed in and saved, ready to go. Come on, folks. Where are you from? Where are you tuning in from? Everybody in Chicago next to Dr. Lagaki? Are you in hot parts of the country, cold parts? We got Winnipeg, Canada.
Couple coming up.
Barry, what's the temperature in Winnipeg? Hit us with a number in the chat if you can. New York, Florida, California, Michigan. Barry said it's 85 in Canada. Man, everybody's hot. Cool. North Carolina, Louisiana.
Got someone
All right, we got folks from everywhere.
Right?
Yeah.
Right.
Yeah, cool. Well, y'all, thank you for joining us. We're going to have some fun tonight. Dr. Lagaki here, I'm going to introduce him in just a second. But I want to get some of the PACE CE stuff out of the way for you. Tonight is hosted by Awaken to Sleep. It is a PACE webinar. So if you stay the entire time, that's the big if you stay the entire time and hang out with us, we're going to have a CE link at the end. Standard information like you all have attended probably 1,000 times. Click the link, do your thing, answer the questions. It should take you 17 to 32 seconds. If it takes you longer than that, you're filling out the wrong questionnaire for somebody else. But you got to do the questionnaire. Will auto-generate your CE certificate. The only way you get it is if you hang out with us for the hour. You guys know that. Like I said, we're going to keep it interesting. We're going to talk some tech, talk some sleep, talk some snoring. I'm sure Dr. Lagaki's got some cool, fun stories in here for us. So yeah, if you have questions, please hit us in the Q&A, not the chat. If you're having technical issues, let us know in the chat. Otherwise, if Dr. Lagaki asks you a question, go ahead and respond in the chat. But your individual questions, please ask them right out of the gate. We want to take them as they come, and we'll hop in. I'll hop in and ask Dr. Lagaki as he's talking tonight, just to keep him on his toes. So yeah, we're going to have some fun. But Doc, I'm gonna introduce you now. So you can queue up the humble remarks afterwards. But I gotta say, guys, I've been a friend of Dr. Mark Lagaki for a handful of years now. And I have to tell you, he is incredibly humble, but incredibly talented. I've never met someone who uses this laser that he's going to talk about tonight the way that he does, and the way that he articulates the words to his patients, and it just flows off his tongue. If you all will spend the hour with us that we're talking about tonight, I promise you are going to glean some amazingness from this guy. He's been Mark, how long you been in practice? I forgot my numbers here. I apologize.
I lost count. 30 years plus, something like that.
A few.
Certainly say that. A few.
Yeah.
Doesn't feel like it because I still love what I do. Yeah.
Yeah. Yeah. You embodied the comment of you never work a day in your life if you love what you do. And I know you love what you do and who you're working with and who you're working for, which is your patients. So anyway, y'all, without further ado, listen to this guy. He's amazing. He's kind, and he's got some truth bombs to drop tonight. So don't go anywhere. Don't put this thing on autopilot. Throw your questions in the Q&A. Stay tuned for the CE certificate. Mark, take it away, man.
All right, guys. Hey, welcome tonight. It's sunny Tuesday after a long weekend. Appreciate you guys coming out big time. We're here today really just to talk about upgrading your sleep dental practice. If you have one, if you don't have one, I think they did a few questionnaires early on to begin with. And I think we got a range of people out there that are either beginning, starting, some that are probably even farther along than I have. So hopefully you'll get a few pearls out of it tonight. A couple things that I like and I'd like to do is just kind of introduce you to what I do. Number one, what's the Solea? What does it do? How does it work? Learn a little bit more about sleep and how I integrate it, move on with that. And then, hey, what do we do to get this treated in our patients? So those 3 topics will be some of the things that I'd like to do to get you through to it. First off, what's Solea and what does it do and how does it do it? For those of us that don't have it, I don't know, there's maybe 2,000 users now. I think I was on the first half of that first 1,000. So I've been doing it about 2 years. Solea is a CO2 laser that kind of gets to what we want, and takes away the fear from our patients. I think number one, people ask me often, why did I get involved in it? I looked at it early on, when there was probably 100 or 200 wandering around out there. We've been out about 7-8 years now. I believe that it does things that I could never do before when we're doing different types of dentistry with it. What do I get out of it? This slide basically says it all in gold right there. It's golden, basically golden. Changes how people think about coming to our office. Each and every one of us probably have a patient, probably had one today, might have had 2. Oh, doc, I dread being here. That's what you hear, or what I've heard for 30 some odd years. And believe me, I don't like hearing it. They probably don't mean it, but they just don't like it. So I won't belabor you with the bullet points, but just look at the last 4 that are on that slide. The reason why I have Solea: happier patients, happier parents, a ton more referrals, and certainly the reviews that walk out our door and then come back in with other people doing what we like to do and keeping people happy. What does it work about and how does it work? The science behind Solea is a little different. Excuse me. A lot of people talk about lasers and, different types that are out there, whether you're using a diode, whether you're using the CO2 laser that we have here, the 9.3 wavelength, and then obviously the YAGs that are out there in the erbium lasers. The nuts and bolts of this is Solea is the only laser out there that's absorbed in our enamel, that's absorbed in the hydroxyapatite that's in there and the water. It cuts more efficiently than anything else out there. Even looking at that graph, you can see the difference. Moving over to the soft tissue, because it is an all tissue laser, what does that do for us? And for me, I was sending a lot of things out, going to perio, going to oral surgery, moving around. Just patients don't like that. They rather do it in-house. When you can tell them that you can do a biopsy in your office instead of sending them out, it's a win-win for the patient. They're not fearful. They're not going to stop going to that practice or, cutting out their appointment, whatever you want to say it is. But when it gets to the soft tissues, it just gets to the right depth where it actually ablates and stops and coagulates those bleeding vessels to stop from bleeding. You can make it a really nice cut and not have to worry about anything. So those 2 things are what's huge when I'm using the Solea laser. Again, I said it works for our patients. Here's the good things about us. When we're looking at different things, and I don't know what you guys have, we're all, you're either patient-driven, insurance-driven, you're driven to do these types of things. I like to get in and get out. My patients like to get in and get out. They don't like to have multiple visits. Myself, my daughter who works alongside of me now, and she's I don't want to say a newbie. She's she got rookie of the year at our office last year. So we get to use the laser every single day. And you take a guy like me from 20 some years worth of hand pieces to using a laser where you used to have tactile sensitivity and you could feel the tooth versus now you're looking and seeing what's going on is totally different. And then you take a youngster such as Dr. Lauren, and she can get through it just as quick, just as fast. So no matter where you're at on the spectrum of how long you've been practicing, it's an easy adaptation to get there. I'm doing multi-quad dentistry now, where before we would do maybe a half a mouth at a time. We don't have to do that anymore. We can do it all and have the patient sit. And the other thing is like that class 5 that's sitting right here, it goes sub G. I think with what we've seen before, you'd pack cord, you'd try to use some hemostatic agent. You don't have to do that in 6-7 minutes. You're pretty much done with that. and, ablates the tissue away, cleans up the tooth, and boom, you can restore it. Another big thing with Solea, and this is huge because we're coming out of the pandemic. Hopefully we're all out of the pandemic. But we still have patients. And even when we came out, what was the issue with safety in our office? You guys are doing a lot more things for infection control. Here, that picture says, it's a picture's worth a million words. There's less splatter with a Solea laser than there is with a high-speed handpiece. As a matter of fact, drill splatter travels 25 times farther. And when we're actually ablating tissues, the Solea laser has less bacteria traveling in those particles, if you will, traveling through the air. So we do much better for our patients and for our team and our staff, really. Some of the fun procedures we get to do, these are some of the things that we've done in our office. Just really quickly, as a matter of fact, I wish I would have had the follow-up. I did this, that abscess removal. Patient came in on an emergency same day. Years ago, what would I have done? I would have said, oh, let's put you on antibiotics, send you to the periodontist, let them do flap surgery, whatnot. That was 1 week follow-up with the laser. And I just seen her again, earlier last week. She had 7, 8, 9 millimeter pockets in those areas. She's down to a 3 with 0 bleeding. The tissues are awesome now, and their teeth are stable. That's huge in my office. Class 2 lesions, do them all day long. People ask, hey, can you remove amalgams? Yes, you can. Certain technique, they're probably good for another time, but it's amazing that you can do some of these things that we couldn't do before. On your far right there, a whole lot of things going on there. We had to do a crown on 29. 30 had a mesial lesion. I did not have to conserve tooth structure. I was able to get to the mesial with the laser. I was able to actually reduce the tooth structure on 29 and refine it with a prep, all done without any anesthetic. Obviously, you can see the crown color choice. That wasn't mine. That was the patient's, because she wanted to whiten later on. And that's, I think, has already been done. I should add another picture of that as well. But this fun continues now because Convergent Dental's come out with their Solea Sleep handpiece, which allows us to take care of some snoring. Does not really, as of yet, studies haven't shown that it does anything with sleep apnea, but sleep apnea in and of itself is a thing that we as dentists need to do for our patients, for ourselves. The ADA may even say right now that it's not, it's a little bit negligent on our part if we're not ruling it out, or at least screening for it. Those things need to be done. And I find that our patients don't necessarily talk about it. And when you start to talk to them about it, their MDs aren't even mentioning it to them. Well, now when I send them back to their MD for something, their MDs, we're opening up their eyes, which leads to more referrals to our office. Biggest thing that we have, and quite honestly, 7 out of 10 of our patients snore. Doesn't matter who you are, it doesn't matter what gender you are, it doesn't matter what body size type you have, people just snore. Snoring is one of the most common breathing disorders that causes some issues. Why does that happen? The soft tissues in the back of the mouth actually vibrate or flutter. The one thing that I see a lot about in our office is how it negatively impacts relationships. And I didn't even know this. 20 years ago, I had a guy that was really high up on the food chain, if you will, working for McDonald's in their marketing department. And you might even see some of his work on some of the big semis that are delivering things for McDonald's. But he lived in an old Victorian house, and his studio was like 3 stories up in the turret of the home. He'd always come to me and say, hey, you got to do something for me. I snore too loud. I grind my teeth too loud. My wife doesn't want to sleep with me. She's 3 floors away and still hears. I'm personally not a marriage counselor, but if we would have had things about sleep medicine 20 years ago, or maybe we did and I just didn't see it, or we'd had things about snoring, I'm sure I could have saved not only his marriage, his turret, his house, his work, his life, all that. The guy must have chewed through 3 or 4 bruxism appliances. I could have made him out of chrome cobalt. He would have chewed through it. So learning from my faults or misknown things from before tells me, hey, there's a lot going on with snoring as
Hey,
well as
Mark,
apnea. Yes.
just to pause you real quick, question. How do you, if patients are walking in and they don't know that they have this issue, or it's not their chief complaint for sure, you've got these tools, how you bring that to their attention? Because I know you do this all the time, and
No,
for the folks listening.
I'm glad you asked that, Michael. Quite honestly, and sometimes we get a little feedback from our patients, new patients rather. We'll put it inside our medical history. We'll put some questions inside our dental history. Most of us out there probably know about the stop bang theory, eight simple questions. I rate them on that. I also have them look at, we do an Epworth scale. Are they daytime drowsiness? Do they have problems staying awake? Do they sit? I have a brother-in-law that you can be talking to him and he falls asleep sitting there. You know, it's not, hopefully it's not because I'm boring, but it's just because he just doesn't get enough sleep, and you can tell. Besides that, we'll see some slides a little bit later. I look at what's going on in their mouth and try to tie that all into the patient, and then just say, hey, are these things happening? And I look for, quite honestly, in the treatment planning process, you want to be an influencer. You need to influence those patients, as you said, don't want to or didn't know they had the issue, or just doggone afraid. Hey, you know, I might stop sleeping. You know, I might stop breathing at night while I'm sleeping. Those things they have to be, I call them trigger points, or you know, pressure points that get the patients to really open up their mind and say, hey, this is what needs to be done, and I better do something about it.
Yeah.
And
Cool.
answer your question for you?
Yeah, absolutely, man.
Speaking of slides, here you go. Sleep apnea, what is it? You know, we have a breathing disorder, right, that interrupts our sleep. We stop breathing. You hold your breath for 10 seconds and try that. I guarantee you I don't know how many people are on this call, but there was a couple hundred and some odd that signed up. Try holding your breath for 10 seconds and then let it out. And, you know, somebody can put it in the Q&A. It's difficult to do that. Try going home and have your patients breathe through just a straw, or better yet, try a coffee stir with their nose plugged. If they have issues doing that and they feel that pain, that's exactly what the patients are feeling when they have sleep apnea, except they don't know it. They're sleeping. You know, I don't have to read the slides up there, but the big points I'll hit on for patients: migraine headaches, weight loss problems for both sexes. You tell a guy he's going to have impotence or he's going to have a lack of sex drive, you know what? I think his ears perk up pretty doggone fast, and they figure out what's going on. Other people that have had strokes or cardiac problems, we all know from a dental end, grinding and clenching, what the tongue looks like and things like that. Those are precursors and tied to what could be possibly sleep apnea. And I never tell anybody that they have sleep apnea. I'm not an MD, I can't diagnose that, but we'll talk about that a little bit later. I honestly think that you can plant those seeds that say, hey, we want to, and I always say this, we want to rule out you don't have something worse going on. I noticed this. Have you been to your doctor? If they haven't, we have some things in our office tent that we can actually get along and go through. What's it look like in a cross-sectional way of how snoring versus obstructive sleep apnea is? First side, you can see the uvula, you see the soft palate, you can even see the airway opening. Celea treats these snoring patients. And by the way, a few slides back, and I should have mentioned this, there's some, you know, there's different lasers out there. You pick and choose. Celea is the only one that does not cut and scar. It gets to the right layer, and we'll see that later on a couple slides farther forward. But when we have partial obstruction, sometimes that's just the soft palate that flutters and blocks and causes that noise. If it's just noise and we've done a sleep test or they've done a sleep test, then they're a viable candidate to be automatically treated with Celea, you know, quicker procedure. If they have a true obstructive sleep apnea, you know, where it's complete and they have these pauses throughout the night, that's a whole different ballgame. Just the laser treatment's not going to work that, but it can help and combined with a mandibular advancing appliance so that we can move them forward. And you can see how that the ones that go from, you know, left to right, open, partially closed, and closed all the way. Those are things that I actually try to show patients just by moving my jaw and saying, hey, we're moving it farther forward. It certainly helps. How do we treat this in a sleep medicine practice or dental sleep medicine practice? Everybody's all over the map right now, and I think that's a good thing because it's coming to the forefront in dentistry. Some guys are going gung-ho and aren't probably ever going to pick up another handpiece, and you can make it that. I haven't chose that just yet. I've got 2 daughters, one that's in working with me and the next one that's halfway through, and hopefully she tugs the rope and pushes me to do some other things here. Partly this, and actually I should give her a shout out. She's the one that put all the slides together too. So she knows exactly what most of us dentists know as well, and then some. I usually screen, you know, and this goes from top to bottom. What's the least invasive? We can just, if they're just snoring, we do laser. If they have a obstructive problem, I walk them into a mandibular advancing therapy. And I'll show you a couple of those appliances as well farther down. Got to remember, guys, and this is something no one tells us, CPAP is the golden rule for medicine. It is the standard of care for them. But the way I hear it and the way I've seen it, and Mike chime in if I'm incorrect, they actually say it's 4 hours. They should wear their CPAP 4 hours a day for 4 days a week. Well, if I'm one of those patients, what the heck happens the other 3 days a week or the other hours that you're not wearing the machine if you don't have it in your mouth? You know, you don't have it hooked up. If we put them in a CPAP in an appliance, they can wear that all night. And certainly being tangled into a rope tied to a wall, for that matter, is not super sexy one way or another. While I'm on the CPAP machines, new info just came out in the last 2-3 weeks, Mike, maybe a month. I forget who it is. Philips, right?
Yep.
A bunch of CPAP machines. How many, Mike? 4 million, 3 million? I don't know.
Yeah, almost 4 million.
So guys, ladies, whoever's out there, you have 4 million opportunities to treat somebody. And you may even get the question now, really, honestly. Somebody comes in and says, hey, I got this nasty old CPAP machine that's been recalled because I might get infected by breathing all their crap in that's breaking down. And excuse me for the French or the English, whatever that is. I'm excited about it. Those guys that get that, have that machine are going to come to us because they want an alternative, or they're going to go buy another machine. My personal MD and I was at a course when that's how I met Michael Cohen at a different course. We were both at a course. I thought it was another doc, and here he's a sleep coach. And we all know that if you have it, your MD is going to say, go get a CPAP. Again, golden standard of care. My guy said, hey, let's get on the internet. And he did. And he goes, oh, you can buy this one. That was it. Just pump some air into your windpipe and maybe you'll breathe tonight. That's kind of how I felt. I've known the guy for 25 years. I'm trying to direct him in a different way now. So
yeah. Hey,
tell
Mark,
me about the recall, Mike.
Yeah, I'll just hit real quick on the stats for that recall. So Philips Respironics, one of the leading CPAP manufacturers in the world, kind of like Coke and Pepsi with the other folks. Their recall is global at 4 million machines, just under 4 million. And the actual advice is to discontinue use of the therapy unless directed by your physician otherwise. And it's a supply chain issue. I mean, recalls happen when they develop tech, but we've never seen anything on this scale. And those patients, they don't have 4 million machines sitting in the backlogs ready to go. Nobody could. So they're doing their best effort at supplying patients with refurbished units or new units or, you know, what have you. That's going to take some time. So I think just to pair this with the news that's happening, when you screen folks and you're talking, hey, have you ever been diagnosed with sleep apnea? Like what Dr. Mark said. Do you have CPAP? Yes. Do you wear it? Yes. Are you aware that there's a recall? Have you spoken to your physician about that? That's it. We're not trying to put fear into people. But the reality is, like Dr. Mark said, the percentage of patients that use CPAP longer than 90 days is less than half. The percentage of patients that use oral appliances over 2 to 5 years is over 80%. Sorry, you got me on you put a quarter in the machine, man. I'm not trying to steal the time, but it's valuable information, folks. So know how to position it. Even if you don't have all the details, you can Google it, check out the recall. But to Dr. Mark's point, we want to help people where they're at, and that's the end of the game. So anyway, go ahead, man.
All right. I appreciate it. Appreciate it big time. Hey, there's a little question out there, Mike, and I might have glanced over it. Isabella, you asked the question about, what other, besides our questionnaires, what kind of screenings do we do? And Mike might touch upon this as well, but, we're checking their airway. We're doing a Malin-Potty score. We're seeing how open they are. We check their soft tissues. We check their tongue. We put them through those things too and throw that all together. Besides, once I see all that, number 2 right here, sleep test. We send them home with a sleep study. Basically, we show them how to work it, and they wear it overnight. They bring it back in, and then we send that to actually we send it to Awaken to Sleep. They have docs, one in every state, that is certified, an MD sleep doc, because we as dentists, at least in the state of Illinois, can't diagnose that. And then we get them scheduled up. So, and I'll go through that, the sleep study with you too, Isabella, on a faster approach, farther down here. I don't know, 4 or 5 more slides, and you'll see that. So we kind of touched on that. Honestly, the subjective signs and symptoms, I can't hit that more than enough. When the patients have these things happening to them, then they don't know it's tied to it. It's our job. It's our, it could be your sleep champion's job. Pick a person out that is talkative and is passionate about it. My assistant has the passion to do it, and quite frankly, she's convinced that her husband passed away. He didn't wake up. He had a heart attack in his sleep. No one tested him for sleep apnea, none at all. Do you think she's aligned to say, hey, you may have this, let's try to rule that out? I do. I certainly do. Again, the testing, a couple different ways to do it. And I've been all over the map, guys. And I'm honing that in even more so now, where because they're coming out with different home sleep tests all the time. But we try to do a home sleep study test. We keep it very reasonably priced, so the patient has really no chance to say no. I don't want to do it. Some are still fearful, don't have the time. They want to check their medical, and I don't do anything with medical billing. There's guys that are out there that are doing it, or doctor's offices that are doing it. Don't want to discourage, because all I know is women. That's all that live in my home. So no offense to saying guys are guys and gals to me. I apologize, but I know with the way things are nowadays, you almost got to spell that out. In lab studies, they can do that. But here's my thought on that. It's not your friendly confines, guys. It's not your bed. It's not your bedroom. It's not your normal surroundings. And to get an accurate result, yes, they may, but it's certainly not as great as being in your own place. And referring them back to their own doc to get some more oomph, if you will, to drive the point home is the other way to kind of go about it. This here is basically kind of a report that comes back, the interpretation. Once we send it back, a few days later, I get this back, and it'll tell me what the observations are. The doctor makes a recommendation, tells us what the alternative treatments are. They sign off on it. Diplomat of sleep medicine, they will send us a prescription. If we're going to do an appliance, they'll give us a letter of medical necessity. It kind of walks you right through it. Isabella, here you go. Screening. When you look at this, I happen to use a couple different types of home sleep study mechanisms. I was using Medabite Junior. I've used the Apnea link here by ResMed. There's quite a few. Someone else just came in, somebody by the name of Alice. That was something new to me. But it was done at another sleep clinic, and then the patient transferred over to us just recently. I think pictures are valuable, super valuable. When you look at this and you tell somebody, hey, look at this orange area here, that's pretty much loaded. You're snoring. Every one of those little lines is a time that you snored. Let's look at the blue line here. Anyone that drops down here means your body's not getting enough oxygen. You're pretty much starving yourself to death of air. When they start to see that, and even before that, they see the first page and they see this in color and they say, oh, you know what? I should be down here and now I'm way up here. A lot of times I don't have to say anything. They're just like, doc, what do I need to do about it? That's huge. That's huge. So I hope that answers your question, Isabella. Treatment types. Obviously, we know we have Solea. You know, that's an Avant appliance that helps move the jaw forward. But for those of us that want to know about how snoring is treated, it's a straight hand piece. The laser lights kind of reduced to help reduce the snoring, and it actually tightens the soft palate. I'll show you that on the next slide and how that does when it tightens it. And quite honestly, I was the very first patient in our office, and I can tell you it works. In how I do it, I'll walk you through that as well. We spray a little bit of acetylene in the back of the mouth on the soft palate, let it sit there for a little while. A lot of people either we suction it out, some of them have swallowed it, don't ask me why, but they do, and that's okay. Occasionally, even if I have to add a little bit more, we do. I tried it just because I wanted to be the guy that didn't do it without anesthetic, just to see how it was. And I was like, well, it gets warm and then it goes away. It gets warm and it goes away. And then I said, heck, I don't want to be curling my toes. Not that it does that. But with just a minor amount of topical, everybody gets through this procedure greatly. I haven't had anybody not at all just yet. And non-surgically, they're ready to rock and roll. I mean, they're getting out of the chair saying that they love it. They can breathe. I've had patients tell me they breathe better now. You know, at first I heard that, I said, that's you know, a pseudo effect. But when I've had some patients that have driven over the state line to come and see me for it, say they're now swallowing pills that they couldn't swallow before, that tells me that that tissue is contracting. And I wish I had it. I don't have it here, but Solea did some studies and you can actually see the tissue contract. And what happens is the laser gets to the right layer, the lamina propria layer, and it shrinks up this collagen layer. It doesn't hit just the top surface like the gag. It doesn't go into the muscle and cut like some of the other lasers out there and then actually scar the tissue. This is right to the lower area that we want. And then it all contracts, tightens up the soft palate, and off you go. We do it in one visit, 5 minutes, really, of your time, doctor time, and maybe they're in the chair 20 minutes. You know, it's time to chat, time to talk, time to bib them up. It's more time breaking down the room than actually doing the procedure. You know, I do some touch-ups, and that's what we're finding out now is as people are coming back, because it's a relatively newer, it's been around maybe a year now that we've actually been using it, that we're seeing some people need to be touched up. I can tell you though, since I was the first patient in our office, the next day, my wife said, dang, you didn't snore. She didn't elbow me. She didn't, you know, roll me over and, you know, kick me and whatever else she's done to me in the past. You know, it happens, you know, sleep on your other side. So it can happen. The next slide I want to show you, and it's only a small segment, and I'll walk you through it. This is the actual procedure on one of our patients that we did. We turned the lights out in the room, and you can see that I'm checking for the vibrating line right there, and I started the midline, and you'll see the laser light. That actual first glow was the beam, and that little sparkling moving effect is the actual laser light hitting those areas. So I take it from that vibrating line all the way down to the tip of the uvula. And believe me, I've seen some long, super long uvulas, you know, I mean, inch long. You have to go find them when they're numbed up. Sometimes that's why I do it in a couple procedures. I do this back and forth, try not to overlap. And what ends up happening is all that tissue again contracts and they're feeling great. 5 minutes later, they're all good and ready to go.
Hey, Dr. Mark, real quick,
Yes.
just to pause you there, because
Sure.
you brought, I came on camera because there were a couple of questions that you were starting to hit and then you just answered them. But for everybody listening, I want to pull back just to make sure that we got it answered. Average number of visits for your Solea sleep case. When do you typically look for not a retreatment, but a redo of sorts? So those two questions.
Right now, I've been doing one, and I've toyed, and a few of my colleagues across the country have actually started doing some of this where we've toyed with even offering two. So it's a combo pack in a sense. So that way we're kind of covering our butt and we're still giving I always like to, under promise and over serve kind of thing. So if we tell them, hey, you're going to need two, and maybe they need the second one, and basically that collagen takes about 21 days. I think it goes, don't quote me on that. Somebody will shoot me for that, but it takes better part of 2 to 3 weeks for the tissue to completely contract. And honestly, I did it on myself a second time, 2 weeks out, just to see if I was going to see any different. I made myself the guinea pig just because I was getting all the studies and everything else from the other laser users and the reports that were coming across. And I just figured, hey, you know what, I'm going to try something different too, to see if it's working. It's the only way we really grow, right? And I didn't have any ill effects. Granted, I'm a study of one on myself, but no ill effects. And this was whatever, I don't know how many months ago, long enough ago. So I would say two. And what Solea Sleep and Convergent Dental is saying is, hey, anywhere from a year to 18 months, they may need to have a touch up. And that's part of the presentation that I tell patients that, hey, if you're going to have you may need a touch up. Here's how it goes. You may need it. Here's the cost. And that's why I'm kind of switching my game plan to say, hey, you're going to need two, just to make sure everybody's happy. I haven't had anybody else really say, hey, no. And I wouldn't mind doing a touch up anyways, just because I know it works. Definitely. Yep. What was the other question? Did I answer them both?
You answered both of those. There was a third one though that was separate. Are there anatomical features specifically, really, you mentioned elongated uvula or the curtain soft palate, where someone has a lot of excess soft tissue in the airway? Are you noticing that those patients require multiple visits versus one? You kind of answered that already, but
excellent question. What we're seeing as a group, the docs that are doing this is, we can count the number of cycles. When that goes on and off, it's on and off for a very short period of time. It's engineered so that you're not overheating the tissues. I run through anywhere from 50 to maybe 100 cycles, depending on the patient. So if you have a longer soft palate, the uvulas that I was talking about, the pharyngeal arches, those are areas that I kind of go after so that I can contract those even more. So sometimes you'll go through a second one. I don't overlap. I wouldn't suggest overlapping. I tried not to. When I first started, I was like 0 overlap. Now I'm getting them, if you want to call it, my spots kind of almost right on top of each other, or touching each other's edge, if you will, if you went like this versus over the top of it like that. I hope that answers their question.
Yeah. Thanks, man.
In following through with that, and I can't stress this more than enough. All the first 4, 5, 6, 7 bullet points are great. You significantly reduced or eliminated snoring. But remember what I said before, I think maybe it was before I came on, Mike was asking me a question. Hey, do you get people that say no? And why do they say no? And I will tell you, I don't want to group men and women into do different things, but quite honestly, my wife would tell you that, I'm my worst patient, even when I go to the MD, and it's probably true. Docs are like that. Maybe not all of us, but certainly this one is. More importantly, men, for whatever reason, and don't give a hoot. Most do not care that they snore. I've had numerous of them tell me, oh, that's not my problem. That's my wife's problem. Oh, that's not my problem. That's my travel buddy's partner problem. I don't care. I'm sleeping. I sleep great. On the flip side of that, the females tend to be more embarrassed by it. They don't want to know about it, but once they find out that they are and someone's told them about it, they're more apt to jump on it and do it right away because they don't want to have that embarrassing situation. So that's why I say at the very end, it stops the disruption of sleep partners. And I will tell you, I actually had a woman a couple of weeks ago tell me that her husband, we had him tested and he was off the charts. He needed a CPAP machine. And she said that's the most unsexiest thing in the world to be. If he's going to get one, I want a machine too. I've never, ever heard that before. Most people say no. And there's, maybe if he does some lifestyle changes and things like that, we may be able to tone him down off of the CPAP machine, but that's the MDs. And even I sent him back to his own physician as well. And that's what they're saying. So those are things that I think, are going to help our patients, not only relationships, it's relationship building. What are those options? We just talked about it. We didn't mention surgery, and quickly, I just had and this blew me away. We sent a patient for a study not too long ago. He just came back. He's a high school teacher, maybe in his early 40s, maybe mid 40s. He had, I think he had an AHI of maybe 6 or 7. It wasn't high at all. And he went to an ENT and they basically said, hey, we're going to remount your nose. We're going to chop off your uvula. We're going to get rid of your soft palate, do all this stuff. The things that you hear about, the UPP or UPPP surgery, it's pretty intense. I've had a few patients that have that. And guess what? Some of them that had it 10, 11, 12, 15 years ago are snoring now and still have issues with airway. So it helps. I'm not saying you want, I like to keep my patients away from, no one wants to hear surgery. CPAP, again, gold standard of care. I've done this my whole career. I've given patients the option of doing nothing because they always ask, hey, what if I do nothing? It's only gonna get worse. Nothing gets better. Your gums don't, you have gum disease, your gums don't regrow. Your liver may regenerate, but nothing else. Your teeth, the cavity does not get better. Sleep apnea, it's not going to get much better either. So therefore, I like the mandibular advancement devices. And then kind of coupled with all that, kind of in the background that we all say something about with New Year's or summertime coming, hey, I'm going to get better. My lifestyle is going to change. I'm going to eat better. I'm going to lose weight. By the way, you put them on an appliance, you treat them for sleep apnea, they're going to lose weight. It just helps them metabolize that much better. The appliance that I talked about, top one's kind of the one I like to use. The bottom one's more of a dorsal fin, both made by Somomed, but here's the thing, there's probably a couple hundred different appliances out there, and depending on what insurance plans you're in, it's a whole different topic. And I'm certainly not the guy to tell you about that, but if you're doing Medicare, Medicaid, if you're doing, I just work it as a kind of a, you're here, it's not covered dentally, here's your fee. If you want to send in the medical, you can, but different companies have different standards for what appliances to use. And then there's obviously certain appliances for certain things to use as well. Kind of moving forward, kind of the nuts and bolts that I think everybody that's on the webinar tonight is, what's it going to do? How's it going to impact our office? We already know we can help patients, and that's my number one goal. And as we help patients, we're going to help that many more patients. You start out small and you build a community. The overall overhead cost, max it can cost you when you sign up for Solea Sleep or start using it. For those of us that have Solea, the laser already, you purchase a different handpiece and they have different package ranges. But I just put this up here to show you, hey, if it was only going to cost you $200 to turn on the machine and laser them, what are we, what's the average now? And I can actually tell you, if you just kind of test the waters there, and I've had some other docs tell me that they have, and you're going to find your sweet spot in your area. In Chicago, it's kind of like right where that's at, 600 to 800. even 500 in some areas. And I think at one time, the other company that also does some of this soft tissue changing, if you will, I can only say it that way, but it's more over cutting the tissue and letting it scar, was way up there, 4 figures and then some. If you do a sleep appliance, the average sleep appliance now, I mean, they have them all over the market, but your average cost can be about $700. If you look at that and you just said to yourself, hey, I want to do one a week, or better yet, you have a bad week. You have a week like today, you have only, this week you have 3 or 4 days left because you had Monday off for the holidays. Look at the numbers. Ask yourself if this is going to change the way you want to practice dentistry, because that drops to the bottom line. I did the math and I said, all right, that's what? I don't know, $2 grand, $2,100 worth of costs off of 10 grand. So you're walking away with, you do the numbers, 8 grand. That is going to pay for your laser. That's going to pay for your CBCT machine. That'll pay for more marketing. That'll do whatever. And guess what? You barely picked up a handpiece. Maybe you picked up a nose cone to adjust your appliance. But this is what it's all about. And it's quick. You don't spend much time. You know, I'm spending, let's say 20 minutes. I'll give the room a half hour to just let my gals break it down and put it back together again. Taking an impression, we scan. Whether you scan or you don't scan, that's irrelevant. You still have time to do that. The appliance is made, you deliver it, maybe call it a half hour each one. This is the way dentistry is going. Definitely, you know, it might be a power struggle with the MDs, but as Michael said earlier, if you can't get enough CPAP machines, somebody's got to do something. And here's what it's all about: fun and games. First guy on the right, some of you guys might recognize him. He asked me if I'd do him, and we did. Snored aloud, doesn't snore at all. In his words, Soleil sleep is legit, guys. It's legit. It absolutely is. Moving forward, this is a super couple. A colleague of mine, farther east, Dr. Yusin Kim, recorded this. Just listen into this and tell me if this just doesn't grab your heart and wants you to do more dentistry. There you go. Hopefully that's loud enough.
Hamilton, and I'm from Elverson, Pennsylvania. The snoring in my life has definitely affected my sleep patterns. It started with me not exactly having as much energy in the morning as I was used to, but the final confirmation that I received from my wife, normally via elbows into the ribs in the middle of the night when I would snore and wake her up.
Herb and I have been married for a number of years. He would roll onto his back and it would sound like the ceiling was going to be lifted by the volume of his snoring.
I would be snoring so loudly and you finally had enough. It's like, no, that's it, man. You're pushing me right out of the bed saying, go sleep on the couch. When I was getting my examination, Dr. Kim asked me about snoring and asked if did I snore, or had my wife mentioned to me that I snored. And I was really surprised. I honestly thought Anita must have called. When Dr. Kim mentioned the Soleil sleep to me, I was surprised. I had never heard anything like this. She described it as a very short procedure and that it wouldn't be painful. It would be very quick and easy. And it was. There was no pain whatsoever. After the procedure, the Soleil sleep therapy procedure was completed, I went home and I didn't tell my wife, and I didn't tell her on purpose because I wanted to make sure that the therapy actually worked. The next morning when I got up, I asked Anita, I said, hey, by the way, did you notice me snoring any less last night, or was it the same? And she said, now that you mention it, you didn't wake me up once.
I'm absolutely getting better sleep, but it's because he's not waking me up all night.
Well, I think one of the things that really intrigued me was how it would benefit you, because if I stopped snoring, you would actually get a good night's sleep. I know, right?
Yeah, you just for me like everything you do.
This therapy has changed my life. My sleep has improved. I'm not snoring. I have more energy in the morning. My wife's sleeping better. I think that's probably one of the more important things. So I think if you snore, I would highly recommend this way of sleep therapy so that you can get on with your life and sleep better.
Yep. All right. I'm telling you, that's what it's all about. Changing lives, letting us help people, you know, and there's ways to onboard it. And I think there was a question, if not, you know, how do I do this? You know, I always, I can't tell you this more than enough. I point them to a sleep study without a doubt. Without that, without diagnosing, you can't really put an appliance in their mouth. And you know, I don't want to say you shouldn't be doing the snoring either, because that's like me doing a mouth guard for bruxism. I used to do them all the time. Now, if they need a bruxism appliance, tell them they need to rule this out. There may be some underlying condition that's causing them to brux. I really believe that. And I also know, and there's a lot of apps out there. You know, we actually talked about this. It's not on the slides. You know, for people that snore, you can, you know, I have patients that run around, you know, tape recording one another. There's actually a free app. I think you can upgrade it too, but it's called Snore Lab. Gives you a score. That's for the people that snore. If nobody is going to bite on or wants to get treatment, I just plant the seed. Maybe I see them in 3 months and mention it again, you know, and if they're not, they get the Snore Lab, they taste the Snore Lab. And occasionally what will end up happening is they'll do, you know, the Soleil sleep first, just to kind of wet their whistle, if you will. And I still say, hey, you have some underlying problem. Let's do this. On the flip side of that is not everybody that you're going to put an appliance in, or better yet, not everybody that has a CPAP is going to automatically just, their snoring is going to disappear. So on those cases, I can do some combination things. And then going back to a few slides ago where it was, you know, 3 of one and 3 of the other, you can do them separately or you can do them together. It depends on the actual individual patient. But in that case, I can laser them as well as put an appliance in and doing fine. How do you do it? You want to onboard this. You know, for those of us that can get started, 2 ways. Soleil, you know, and Convergent, they have a great course, great training. They've got a coach now that kind of reaches out to the people that are doing sleep, make sure you're doing it, answers your questions, does all that. They even offer, you know, an introductory kit for testimonials, all the office posters and things to kind of just put it out in front of your patients. We have some stuff, the brochures now that we have just sitting out on the counter so that people take them home. They can actually take them home to their spouses and their friends. Getting that going from a snoring aspect is awesome. They certainly do it right. The other guys, both of them, Convergent, and I want to thank Convergent as well as Awaken to Sleep for having me and sponsoring tonight, and just getting the word out is Awaken to Sleep. You've heard Michael Cohen speak, Chad Wooter's the guy on the left, and Dr. Greg Manning, he's actually another Soleil user. They do some great things. I've had Michael come out to the office and just sit with my team for a couple days and just go through step by step, how to say it, when to say it, what forms do you need, what do you test for, how do you read the test, put up hiccups. They have something called Sleep Hero that sometimes I'm negligent and not really looking at, but it's really a library of things that you can teach your team all kinds of things with. And I want to say Chad mentioned something. Mike, you can answer this, but because of tonight, you guys are doing something special for them or for the participants.
Yeah, since you're on the slide, Mark. So our weekend course, we've got July 30th and 31st coming up here this month. So everybody who is an attendee tonight, if you click on the link or go to awakentosleep.com/events, you'll see that the July event is discounted for this course. So anybody who attended, if you guys go there, you'll be able to get the course for $397 instead of $597. To be clear, that's for 5 attendees and everybody gets 14 CEs. So if you actually bring 4 of your staff members, that's $5 per CE. And we promise not to be boring. I think that's the main thing. Like, it's virtual, it's on Zoom. There's a a tentativeness. I'm like, do I really want to do this for 2 days? We have a lot of fun with it. I would say it so I want to get out of your way, Mark, but as simply as possible, folks, if you are interested in doing more with your sleep program, integrating Solea Sleep into your sleep program, where do those fit with appliances, etc., hop on a course, get some cheap CEs and see if how we're talking about it makes sense, because we just drop everything that we can in the course. And if you show up for $400 and if you don't get anything else, you'll get $2,000 worth of coupons towards those appliances that Dr. Mark was talking about earlier tonight. We really try to make it worth your while to spend a couple of days with us. So yeah, that's it. That's the 30-second sales pitch with no apologies. We like to have fun, and we do it on the weekends via Zoom. So if you want to do that and learn more about sleep, we'd love to hang out.
Awesome. Thanks for doing that for these guys. Because honestly, guys, it's changing the way I'm practicing. Solea has, sleep is as well. I still got some ladders on the rung that rungs on the ladder that I want to step up to and reach for the higher ones. But this can get you there. There's no doubt about it. Both products, both companies are well versed in what they do. Without a doubt, I'd say go for it. Jump in. Both feet. You got to own it. If you want it, you got to own it. This slide I put together a long time ago. It's meaningful to me because we all got to kind of crawl before we walk before we run, and learn how to run before we do the marathons. And I've been doing marathon dentistry for years, and it's fun. I still enjoy it. Solea has most undoubtedly given me that new jump and bounce in my step. And by doing sleep as well, with appliance therapy, it's opened up different avenues, more than I ever thought it would, guys. Tell me if you got questions. I really want to say thanks to everybody, especially my team, my daughters, for helping me put this through together. I didn't have to scream their name and say any technical difficulties here, so we're all good. Let's do this. I'm always here.
We got a lot of questions, so I'm gonna.
There you go. Start answering.
Let's get to them.
Let's do it.
And folks, if you got questions, throw them in the Q&A. We'll get to them. You're welcome to leave after a few minutes from now. The course certificate link is in there, so go ahead and click that to get your CEs. It's in the chat right now. That being said, we're going to stay as long as you've got questions because we're here for you. So I'm going to get to it. First question. Tim asked a while ago, what brand of home sleep test do you use? I know you answered that. And where did you get them? So you mentioned the Brabon and the ResMed.
I did Brabon, which is Medibite Junior. I got the Medibite Junior from Brabon themselves. And the ResMed's Apnea Link, I actually got through Awaken to Sleep. There you go. And I understand you have some new ones too, so I won't go there. There's plenty out there. There's some now that are, and I have a patient that actually I have a whole family that comes back periodically from actually Mike's neck of the woods somewhere in California, I think Sacramento. They fly in every 3 months, and the mom just said, hey, I think my 22-year-old's got sleep apnea. Can you send me out a test? And I actually called you guys. I think I talked to Jeff or
Yep.
Chad might even said we now can send them one, and I don't know the technical behind the scenes jargon, but whatever it does, it collects all the data. They get it through the web, as my kids will laugh at me right now. The cloud, I don't know which freaking cloud's mine, but there's a cloud up there it goes to, and then they can dispose of the actual device, and we got all their information.
Yeah.
Does that answer your question, Mike, I think, or is that how it works? I have no.
Yeah, no, I would just say my recommendation is there, like Dr. Mark, like you said, there's a lot of units out there. There's a lot of them that do very similar things. There's some that are different. I would say if you all are trying to bring home sleep testing into the practice, number one, check your state guidelines, because there are only a few states that disallowed that. Most have allowed it. I would strongly recommend that you're able to do, or if you're able to do it, strongly recommend that you do it. Most patients will say yes to you when they will say no to an outside company or waiting 3 months to go see a sleep physician. That's not a bad workflow. It's just less people say yes. We want more people to say yes, more people to get help. So as far as evaluating brands, on our website, we have a free coaching call. If you guys have questions about sleep tests, we can answer them for a variety of manufacturers. I would try to lean into something like that unless you already know exactly which one you want, because there are pros and cons with different types of units. Cool. I'm going to move because we got more questions. Back to the Soleil Sleep side. If you have to do a retreat or a second visit on a patient, is there a $200 overhead cost for that using the laser? And how do you handle that from a fee standpoint?
You know what? There is, and that's something that's just because they do a per use charge. And I mentioned earlier, but they have a different, you have a couple different packages. You can buy a small package, you have a big package, you buy a bigger package, you buy an unlimited package. Depending on what you're doing and where you're at with your sleep program, whether you're implementing it or it's full steam ahead, that's a decision that each individual office or doctor needs to make. But there is an additional cost. And that's why earlier I said, hey, I'm toying with the idea of just saying putting that cost up front. You know, for instance, let's say it's $1,000, you're going to get 2 of them. If they need the second one, guess what? You already got it incorporated into your cost so you can manage those fees. Another thing that I was actually just early on talking with, there's all different ways to go about it. Mike had mentioned, before we were on, he asked me a question when I forget how the question went, but was would we basically, can we change our fee structure? Would I think about changing my fee structure to allow a sleep test and maybe the laser together, or the sleep test, the laser together, and an appliance? So there's many different ways you can package it to it. You just got to make sure you know what your costs are, just as much as you know what a cost is for a crown or whatever, if you're placing a Reston, what each cartridge or carpio of a Reston costs.
Yeah.
So hopefully that answers that question. There is a charge, and I try to manage it with saying, hey, if we're going to do a touch up, here's what it is. And a lot of times I'll just do it at half price. So that second one, I'm not, the return is not as large, but it entices the patients to do it.
Yeah. Yeah. Good call. And I think also the take home here that you mentioned, but I want to make sure sits with the audience. When you're charging cash, you can change your fee schedule. You're not subject to the insurance reimbursement right now. So in Dr. Mark's example, he's the one setting the fees for the practice on the Soleil Sleep procedure, whether he does 1 or 2. He's got to know his costs. He sets the fee. He knows what his own costs are to run a home sleep test because he has it in-house. If he does an appliance, same thing. So when you start to bundle some of those treatment plans together or testing together, you have the freedom to do it so long as the costs fit in your fee schedule. To your point, Dr. Mark, that's the know your costs, account for them appropriately, and then run with it. Okay, next one is how long do you counsel patients that they should have results for? So how long should it take before they feel the results or hear or don't hear the results from the Soleil Sleep procedure? And then how long should that last before they're looking for a touch-up?
Great question. I had mentioned that Snore Lab app. So my snorers, I have them do that. I actually have them do that before I even do the treatment. We have them texted to our office cell phone, so I can see their score. I know what it is, and I can kind of guess what it is. And it goes from whatever, 0 to, and if you get a 0, that means they're basically not breathing. No, I shouldn't say that. But I think you're golden. At least the docs that I talk to, we like to aim for 20 or less in the way the Snore Lab uses their numbers. You can even play it back to you and hear the snoring. And I also have them do that after the fact. And there's some things that affect that. Was it a crazy weekend? Were they out indulging in some alcoholic beverages? That's going to relax those tissues just like it relaxes all the other muscles in your body. So you're going to get more snoring. That fluttering is going to happen. So I watched that for a while. And, we get some great patients that are like, look, here's my score. Here's my score. I had somebody ask me if I could fix their fan because that was getting their noise. I mean, no, I can't do that. They had a ceiling fan going. They picked up that. somebody else that's snoring, and really it's just on your phone, you put it on your nightstand, somebody's dog was barking or shaking, you could hear their chain shaking in the middle of the night, that upped their score a little bit. So you watch those scores, and like I said, most people are up about, with Solea Sleep, an hour, a year and a half. I may, and I don't know, I like to err on the caution side. So when they come in at 6 months and a 6-month interval for their hygiene check, we ask them, how are they doing? What's their bed partner say? It's a candid, easygoing conversation. How you feeling? What do you do? Quite honestly, it's annuity. You know, think about, and I don't do Botox, but docs that do Botox, or quite frankly, our recare system, if you have those people coming in all the time, they're automatically going to do their next cleaning or their next perio maintenance. They're automatically going to do Botox. You know, my wife just went for a facial tonight. Do you think she's going to go back next month and get another facial? Whether she needs it or not, she's loving it. She's going back. You know, and I say that, and I'm not picking on her. If you're out there, Joan, listening to me, don't shoot me. Don't elbow me tonight if I snore either. And I won't snore. Here's the thing. You're going to do this, and the difference between dentistry and medicine, think about this. Anytime you personally go to your own MD, what are they doing? They're diagnosing, they're troubleshooting, and they're sending you on your way. And it's not an exact science. What we've learned, whether you're a new grad or you're in dental school right now, for those that are listening, or you're a 30-year vet like me or more than I am, in dental school, we were taught, it was burnished into our skull. It's got to be perfect. It's got to be a certain isthmus width. It's got the crown prep margin's got to be perfect. Everything's got to be perfect or it's not going to work. Well, I have seen things in 30 years that I did 30 years ago, and it's still there. And I was like, dang, that's my work. It's still there. And I'm a straight shooter. Medicine doesn't do it that way. If a knee goes bad and the guy replaces a knee, what happens in 2 years, 5 years? It gets an infection. He falls down the stairs and cracks it, and they got to replace that knee. What do? They replace the knee.
Yep.
So when we're doing sleep, we're going to replace an appliance. They're going to grind through it. You got to change your mindset and actually change the patient's mindset along the way so that they understand that they know, hey, you know what, this is going to last for so long, and you're going to have to re-up, whether you like it or not. You're going to have to re-up. Nothing's forever. Think about if you had a new car. You bought a new car. What do? Change the oil every 3 months. They probably get it washed every week at the place that has the, hey, come as many times as you want a month car wash.
Yeah.
Now, if they asked you, you only can have that car one car only for the rest of your life, I guarantee you they'd take a lot better care of it. We're asking our patients to do the same thing.
Yeah. And I guess on that note, to your point earlier, if you're including 2 Solea Sleep treatments in the original treatment plan, and you're charging for that, let's say it's the $800, then if you have to add a third one down the line when they need it, having a stated price that's less than the full 800, but more than half, they've got a discount for the first 2 that they're doing in that
Absolutely.
bundle. So
it's all about something I learned way back in school. U of I, shout out to those guys. Inform before you preform in anything you do, guys, in anything you do.
Practical question. Dr. Mark, what code, and you may or may not know this because you delegate well. What code do you use for Solea Sleep? We know it's not covered by insurance, but for record keeping in your system, is there a code that you use, or is that somebody else?
Yeah, actually, I probably do. Nah, you know what? I don't know if I know it. It's D999, and then I got a couple letters after it. Might be SL for Solea or SS for Solea Sleep. Honestly, it's just an internal code. When it comes up on their whatever it is statement, it says D999 and it says Solea Sleep on it. But the SS allows us to know that it's there, because it's a non-chargeable dental thing. And right now, I don't think there's anything in medical that is covering it. I could be wrong on that. I'll let you answer that question, Mike, but I'm not sure.
Yeah, no, it's by not being covered under medical, it's just really how you're tracking it internally. So you guys can do that customize it how he mentioned. Moving on to a different question. Somebody asked about the link for signing up for the event. I believe that was in the chat. Chad, if you're listening, if you could repost that so people can just click it and make it easy on them.
I'll go back to that slide too. Just before I go back to that, guys, screenshot this or whatever. If you guys have questions, you want to reach out to me. That's my email address, simple, Dr. Mark at Ligocki Dental Group. Heck, check out our Instagram and Facebook pages and things like that at Ligocki Dental Group. I try to do a little something on the I don't know what I call it, dental side with Dr. Ligocki, just putting little tidbits of things, good, bad, and indifferent that I do out there. And then Ligocki Dental Group, we do a bunch of fun stuff. Thanks to my whiz kids, that's for sure. Going back to, there it is.
Cool.
Wakingtosleep.com/events for whoever needed that. Just helping out.
Thank you.
Get the education. It's well worth it, guys.
Thanks, Mark. Yeah.
You're welcome.
What, so chair time, let me ask you, this is kind of a hybrid question from a couple of different people. How much time does it take you to complete a Solea sleep case? Soup to nuts. So team time or room time, I should say, versus your time. And then same question for an OSA case, which obviously is more involved, multiple visits. Roughly your time for each of those?
Sleep, I spend Solea sleep, I spend a half hour, and not even that. That's the whole time. You know,
Okay.
I mean, that's for breaking it down, having my assistant slowly sterilize the room. I mean, it really, it's less than 5 minutes in the patient's mouth. If they have a lot of saliva or they're a gagger, it might be a little bit longer than that. So give yourself 10 minutes of doctor time, max. If you're taking more than 10 minutes, call me, honestly. And the other 20 minutes is really just, I like to cultivate relationships. I'm sure there's going to be other docs out there and say, hey, you can do this in a bunch of rooms and roll your Solea machine. By the way, it's got its own compressor in it. So you can take this and, you know, if you wanted to work out of your garage, you probably could. I wouldn't recommend it.
Yep.
But you don't have to have it hooked up to your own air supply. It's a half hour for sleep and then for Solea sleep. And I don't know, I'm probably a slow scanner. I have a CEREC machine and I scan, and I like to be ungodly proficient with my scan. So I don't have the wonderful prime scan just yet. That's a big yet for right now, because we just built out a brand new office, partly because of some of the stuff I'm doing here. And I've got 2 hungry kids that want to get off my payroll and onto their own. So it's all going to be fun. But the sleep stuff with appliances, I do it over two appointments. Again, I give myself a half hour. You know, occasionally we'll go back to the old analog way just because somebody's using a scanner, somebody's not. Still a half hour, take a bite, use a George gauge. And those are things that I'm sure Waking to Sleep or anybody can show you how to do. And then I schedule, 3-4 weeks later to get the appliance back from my lab, and boom, we deliver it. It's another half hour. Even sometimes it doesn't even do that. I walk in, it slides right in, and I'm good to go. I just need to talk to them about it and how, what to do, and post-op follow-up care, basically.
Yep. Yeah.
And your assistant can do that. I just like to do it myself.
Right. So we had another question. It just went away. I think Chad might have answered it, but somebody asked, can we get the $200 discount for a future course? The answer is yes. We have 10 spots left on this particular course that you guys will go to for July. If you want a discount on a future course, book a ticket for July and message us either in the chat or reply to that email and say that you'd like to move it. That's an option. I was corrected, 9 spots. Sorry, guys. So yeah, if you're interested in that, we're not sticklers on that. Just let us know when you can do it. That's the only event that's discounted. So please grab your ticket while you can, and then we can move it for you. Coming back to clinical. So Chandra had a question. Why do we need to repeat the treatment? Are the changes that the laser did to the collagen not permanent?
Great question. And I'm not the scientific bioengineer, but yes, your collagen is going to relax. It's going to go back over time. It's going to stretch out. and you're going to have to tighten that back up again. So
yeah, and
you know,
Dr. Mark, I would
can't
say
it's
to your
not-
point,
go ahead.
I was going to say to your point earlier, setting the patient's expectations properly from a medical standpoint. This is the job of the laser. Here's what it does. Here's what it's going to do when I use it on you. Here's what you should expect. We may need to do that second visit. You may need this in 12 to 18 months, per your comments earlier. I think
Exactly.
that you just do this naturally, man. I started this off tonight. You just talk to people like you're talking to me, and it happens naturally for you. I want to make sure the audience doesn't miss that. When we're dropping that out, you're just laying the groundwork for those future conversations, to Isabel's point.
You know, and I can just add, and this has nothing to do with sleep medicine at all, but the confidence that you have in yourself. And I've talked probably to you about this, Mike. You know, one day I'll write a book about the wow words or the power words or the ticklers, whatever you want to call it. But some of the other guys that are in practice management will tell you, own it. You know, don't go in and say, oh, I think you got a little bit of snoring. You know, no, you don't. You got snoring. I don't know anybody that's a little bit pregnant. You know, my wife was not a little bit pregnant. I had 2 beautiful kids. They were not little. You know, It happens. So, you know, you got to be confident in how you say it. And you know what? I wish I would have known that 25 years ago. You know, honestly, I'd be in and then I'm not in a bad position. Dentistry's done great, but you know what, people, that's just what happens. It's nothing that none of us don't already know, but you know, that creates more even word of mouth ideas. They go home and they talk about it, and guess what? Somebody rings your door or calls you or, you know, drives over. You know, with Celea, I've had people just call because their kids went to pediatric dentists that had Celea. And you know what? The parents never once needed any restorations, but they just want to make sure that they have a Celea dentist. There you go. I mean, it's a different niche.
Yep.
You know, same thing with sleep medicine. Get on board.
Yep. So getting on board, I see in the chat, somebody beat me to the punch. The discount is available through Friday. There's 9 spots, or through Friday. If you're picking a different date, I broke things. Use the coupon code Convergent. We want to give credit where it's due from the course tonight or the webinar tonight. So if you guys are trying to book that, that's the easiest way to do it. Go ahead and do it that way. By Friday, that's the deadline. I still have a couple more questions. So are you okay? I know you're a couple hours ahead of me. I'm a little spunky here.
No, but you're good. I'm ahead of you, and the guys on the East Coast are, you know, they might be wanting to hit the news or something or snoozing. That's all right. I'm good. As long as you guys are good, I enjoy it.
Cool. So are there contraindications? So the same person had a couple of different questions.
Sure.
One is, if someone has a uvula removed, how does this therapy work with the Celea Sleep laser? One, and I would add to that, would it be necessary? And then number 2, are there contraindications for Celea Sleep that you wouldn't use the therapy on certain patients?
Speaking from experience, and the experience is not vast, I have done a couple patients with Celea Sleep that have had the UPP surgery. So their uvula is gone, disappeared, non-existing, and they were snoring. And I didn't, honestly, when I did the very first patient, I told them, like, you have all this removed, you still have some soft palate there. Let's hit the pharyngeal arches and see what we can do. It helped him. I don't believe it helped him as much, but it did help. So we got some improvement. Again, I set the expectations. I didn't say, yeah, let's do this and see what we got, and say, hey, it's going to help. I haven't done it. And I'm okay with saying that. Contraindications, you know what? Actually, Celea just came out with a newer handpiece that extends out a little bit more so that you can get some retraction. I don't know if it's a contraindication, but when you get some heavy duty gaggers, it's really tough to get as far down as you can. And somebody asked that question earlier, do you do it over a couple treatments? Sometimes you have to do it in that regard. And you know what, if it's 1 or 2 like that in a long period of time, you know what, it's well worth doing it. I have not, you know, the other contraindications, we didn't really hit a lot on that, but This is for mouth snorers only. So if you're talking about somebody that has a deviated nasal septum, has large tonsils, has all these other things that are causing snoring outside of the soft palate, those are your contraindications for doing laser therapy. Might help a tiny bit, but it's not going to take care of those other issues.
Yeah, good point. Nasal snoring is not going to be assisted by helping their oropharyngeal crowding with soft tissue.
Exactly.
Chandra asked, do you use a CBCT to measure airway in the practice?
You know what? We have a CBCT, and I'm not the guru that uses it. Dr. Lauren is. And quite honestly, yes, we can map it out and measure it. It's not a diagnostic tool. It's another one of those, what I call colored pictures. Here's your airway, open with your jaw pulled forward when we move them. Here it is where you are right now. Look at it. And then it'll calculate out that number with the CBCT that we have and say, okay, here's your volume. So yes, you can, but it's not a diagnosis. You know, it's great for the patient to see and us to see. But right now, you can't just simply diagnose sleep apnea with just the closed airway that way.
Yep. And that's why you have the home sleep tests. So
Bingo.
Cone Beam is a great tool for screening airway constriction. Snore Lab is a great tool to screen for snoring at home. Snoring is also related to sleep apnea, but the only folks that can diagnose obstructive sleep apnea are MDs, no matter what state you're in. So we got to get that home sleep test data to the sleep physicians that can actually diagnose it. That's the main thing. So let me see, we got that number of treatments, total time. Man, I think that's it. You got it. Right before half an hour passed. I'm impressed.
Hey, we did all right, guys. Again, I just want to say thanks to everybody that's even stuck through it. There's still quite a few people on here, some bailing right now. That's all right. Go home, get a snack, work out, love your kids, love your wife, love your husband, love anybody. Keep breathing. That's the name of the game. Keep breathing. Breathe while you sleep.
And I also do want to thank Convergent and the Soleil Sleep folks. We appreciate you helping us put this on, getting the message out there. And for those of you guys that are attending, we're here to serve you, all of us. Dr. Mark put his personal information out there so you could email him. Ours is on our website, and the Convergent folks are outstanding at their support. So if we can help, give us a call. Other than that, sleep well, y'all. Have a good night.
All right, guys. Have a great night. Look forward to seeing you out there. Take care.